Most Singaporeans with diabetes have poor blood sugar control. A 2025 survey showed that 6 out of every 10 persons with diabetes in Singapore have unsatisfactory blood sugar control. That means 60% of diabetics in Singapore are at clearly higher risk of having their diabetes progress over time in terms of both severity and diabetes complications. Very concerning indeed. And if you have diabetes, and if you are listening to this, and if you are one of those 6 in 10 Singaporeans who do not meet targeted blood sugar control levels, I want to encourage you not to ignore it. You must do something about it. You can do something about it. And specifically, there are 4 things that I want to highlight to you at the end of this podcast. Welcome to another episode of Kopi-O Kosong with Dr. Chan. And in this episode, I want to highlight this very concerning statistic buried in the National Population Health Survey 2024, published by Singapore's Ministry of Health, that more than 60% of people with diabetes in Singapore are walking around with poorly controlled blood sugar levels, not meeting the targeted blood sugar levels, which are levels deemed to be necessary to help minimize diabetes progression and complications. Why? It cannot be due to the lack of trying. Singapore has tried very hard. It has been 10 years since the Singapore government declared war on diabetes. Millions of dollars have gone into awareness campaigns, community programs, and intervention initiatives. And yet, 6 out of 10 persons with diabetes still do not even meet the targeted blood sugar control levels needed to minimize diabetes progression and complications. Singapore has one of the best healthcare systems in the entire world. Singapore was even declared a blue zone a few years ago, one of only 6 blue zones in the world where people live longer and healthier lives. And yet, 6 out of 10 persons with diabetes in Singapore still have poor blood sugar control levels. So we cannot blame it on the lack of effort or investment by the authorities. The Singapore government has done more than any, or at least most other governments in the entire world, to raise awareness, to improve education, and to provide services, both clinical services and other support programs for people with diabetes. And yet, 6 out of 10 persons with diabetes in Singapore still fail to meet blood sugar control targets. And when we dive further into the survey findings, amongst those already known to have diabetes, people in their 30s perform the worst in terms of blood sugar control. More than 80% of them did not meet blood sugar control targets. And among those with secondary or post-secondary education, almost 70% failed to meet blood sugar control targets, compared to about 60% among those with primary education. So we cannot blame the lack of education. In fact, the survey showed that the more educated ones performed worst. I am very concerned about this. But why am I concerned? I am not a politician with responsibility for people's health. Neither am I a senior civil servant tasked with leading Singapore's war on diabetes. I am merely a medical doctor who has spent the past 10 over years deeply involved in the front line of training and coaching people with lifestyle-related chronic diseases such as diabetes to use lifestyle and eating habits changes and improvement to better control, to reverse, to combat their conditions. I'm therefore concerned because I know what poor blood sugar control for people means, what the serious implications are. I have had many patients sharing with me their regrets of not making the effort to improve their blood sugar control much earlier in their lives, and only waking up to do something about it only when complications such as blindness or kidney failure began to set in. I've seen the devastations of diabetes complications on the lives of many, all contributed significantly by poor blood sugar control over a long period of time. It need not be this way. It should not be this way. And if I can help it, and if I can help just one person with diabetes become more activated, more motivated to do something about it, to do what they can, whether through better medications compliance or targeted lifestyle and eating habits improvement, or both. If I can do something to help just one person with diabetes, I would. So now, let me speak directly to those of you who have diabetes and listening to this now. 4 things that I would like to emphasize to you. Number 1, The complications of diabetes are many and can be very serious, including stroke, heart attack, blindness, kidney failure. They can potentially take away years from your life and life from your years. Number two, these serious complications are not inevitable. They can be prevented or at least delayed or reduced to some degree, even if they do eventually happen. Number three, one of the things that you can do is to consistently meet the blood sugar control targets set by your doctor. There are many blood sugar measurements that your doctor may monitor for you. Amongst them, HbA1c is the most commonly used measurement as the blood sugar control target. If you're not sure what that is or what target level your doctor has set for you, consult your doctor the next time. Have a discussion about it at your next regular follow-up. Number four, before I go into number four, let me highlight that you must always work closely with your doctor, especially if you are prescribed diabetes medications. Do not stop or reduce your medications without consulting your doctor. Okay, now back to number four, which is that lifestyle and eating habits change and improvement must be the cornerstone of what you do to improve your blood sugar control, to meet your blood sugar control target. And you should aim to do it holistically and sustainably, and not through some kind of 23 days or 90 days special diet regime that promoters promise will help you control your blood sugar better. Don't be distracted by those special diets or hacks, but focus fully on making targeted and comprehensive lifestyle and eating habits change that are sustainable forever for life. Because your personal war on diabetes is going to be for forever, not merely a 23-day or 90-day campaign. So those are the four things that I hope you would take away if you have diabetes and if you are not controlling your blood sugar level well. Number one, diabetes complications are not minor inconveniences. They can take away health and life. Number two, you can and should minimize your risk of diabetes complications. Number three, one of the most important things to do to minimize diabetes complications risk is to meet your targeted blood sugar control levels consistently. And lastly, number four, holistic, comprehensive, and sustainable lifestyle and eating habits change and improvement must be the cornerstone of your endeavor to achieve good blood sugar control. Changing lifestyle and eating habits is never easy, but it is entirely possible and totally life-changing. Get help if you need. Work with a lifestyle medicine-focused medical doctor to coach you, or join some kind of support programs. Do whatever you are willing and able to consistently achieve your blood sugar control targets, because it matters. And I would also like to highlight something very important to every person with type 2 diabetes, that type 2 diabetes is potentially reversible if lifestyle and eating habits changes are made early enough, appropriately, adequately, and sustainably. I have a structured online learning program called Reversing Type 2 Diabetes, the Essential Basics, that I developed to help people with type 2 diabetes equip themselves with the must-know foundational knowledge of reversing type 2 diabetes. If you are keen to find out more, the link should be somewhere in the description or notes of this episode, depending on where you are watching or listening to this podcast. Or go to my websites, thehabitsdoctor.com or thehabitspharmacy.com. You should find the info there. I hope you have enjoyed this podcast episode of Kopi-O Kosong with Dr. Chan and found it useful. Let your habits be your medicine to combat lifestyle-related chronic diseases such as diabetes. See you at the next episode. And until then, eat well and be well.